Hey everyone, today we're going to tackle a test that can seem super intimidating, but is absolutely essential in a crisis, the arterial blood gas, or ABG for short. It looks complicated, I know, but trust me, we're going to break it down and make it totally simple.
So picture this. You're in a packed emergency room. A patient comes in, they're really struggling to breathe. How in the world did doctors get a quick, accurate snapshot of what's going on deep inside that patient's body? How do they read that critical internal weather report to make split-second, life-saving calls?
Well, that's where the ABG comes in. It's this incredibly powerful blood test that gives us a peek into the delicate balance of acids, bases, oxygen, and carbon dioxide right from the blood coming straight from the heart. It's literally like opening a window to look at the body's most fundamental operations.
So here's our game plan. We're going to build this from the ground up, starting with the body's amazing balancing act. Then we'll decode the test itself. After that, we'll learn to spot the four main problems. I'll give you a simple four-step guide to interpret any ABG, and finally, we'll see how it all comes together in a real clinical setting. Ready? Let's do it.
Okay, first things first, we have to talk about the body's constant, non-stop balancing act. Our bodies are working 24/7 to keep our internal environment just right. And probably the single most important number for this balance is pH.
So check this out. The body keeps its pH in a super tight range between 7.35 and 7.45. I mean, that is an incredibly narrow window to work in. If that pH number drops below 7.35, the body is in a state we call acidosis, way too much acid. And if it climbs above 7.45, that's alkalosis, too much base. Either way, it's a huge red flag that something's not right.
All right, so how does this ABG test actually measure that delicate balance? Let's pull back the curtain on the test results and meet the key players that tell us the whole story.
Now, this table might look like a lot of numbers, but don't get overwhelmed. While oxygen levels, the PaO₂ and SaO₂ are definitely important for understanding the body's balance, we're zooming in on the big three: pH, PaCO₂, and HCO₃-. Just think of it like this. PaCO₂ is the respiratory part. It's all about the lungs. And HCO₃-, that's bicarbonate, is the metabolic part. It's handled by the kidneys. So why this test specifically? What makes it so special? Well, it is the absolute gold standard for checking how well a patient is breathing, for catching those critical imbalances we just talked about, and for guiding treatments for the sickest of patients, like when they need oxygen or are on a ventilator.
Okay, and that brings us to the real heart of reading an ABG, learning to spot the four main patterns of imbalance. Each one tells a totally different story about what's going on with the patient.
First up, we have respiratory acidosis. What's happening here is the patient just isn't breathing effectively. It's called hypoventilation. Because of that, carbon dioxide, which is acidic, starts to build up in their blood. So what you'll see is the pH goes down and the PaCO₂ goes up. This happens a lot in things like COPD or a bad asthma attack. To try and fix this, the kidneys will start to hang on to bicarbonate, but, that's a pretty slow process.
On the flip side, we've got respiratory alkalosis. This is the exact opposite. It happens when someone is hyperventilating, breathing way too fast, maybe from a panic attack, pain, or even being at a high altitude. They start blowing off way too much CO2, which makes their PaCO₂ drop and their pH shoot up. And how does the body compensate? The kidneys try to get rid of that base, bicarbonate, to even things out. Okay, let's switch gears to the metabolic side. In metabolic acidosis, the lungs aren't the problem. The issue is either the body is making way too much acid, think of diabetic ketoacidosis, or it's losing too much base, which can happen with really bad diarrhea. You'll see both the pH and the bicarbonate levels drop. The body's emergency fix? The lungs jump into action and speed up breathing to blow off as much of that acidic CO2 as they can.
And our last one is metabolic alkalosis. This is usually from losing acid from the body, and the most common cause is severe vomiting. This loss of acid makes both the pH and the bicarbonate levels climb higher and higher. To compensate, the respiratory system does something that seems a little weird at first. It actually slows down breathing. Why? To hang on to that acidic CO2 and hopefully bring the pH back down to normal.
Okay, I know that was a ton of information. Respiratory, metabolic, acidosis, alkalosis. It's a lot, but don't worry. We're going to wrap all of that up into a super easy four-step method that will let you figure out any ABG you come across.
It really is this simple. A great way to remember it is the mnemonic ROME, respiratory opposite, metabolic equal. So, step 1, look at the pH. Is it low, acidosis, or high, alkalosis? Step 2,
Look at the PaCO₂. Is it moving in the opposite direction of the pH? If so, the problem is respiratory. Step 3. Check the bicarbonate. Is it moving in an equal or the same direction as the pH? Then the problem is metabolic. And finally, step 4. Look at the other system to see if it started to kick in to try and fix the problem.
All right, time to put it to the test. Let's try one together. Here are the numbers: a pH of 7.30, a PaCO₂ of 55, and a bicarbonate of 24. Take a second, run it through those steps.
So, what do you think? What's the diagnosis here? Is it acidosis or alkalosis? Is it a lung problem or a kidney problem? And is the body trying to compensate it on? And the diagnosis is uncompensated respiratory acidosis. Let's walk through it real quick. The pH is 7.30, which is low, so that's acidosis. The PaCO₂ is 55, which is high, so the pH is low and the PaCO₂ is high. They're moving in opposite directions, right? Rome tells us that's a respiratory problem. And the bicarb? It's 24, which is totally normal. So the metabolic system hasn't even started to compensate yet. See? You got this. Now that we've cracked the code on how to read an ABG, let's bring it back to the real world. How is this test actually done at the bedside, and what are the really important things to keep in mind?
Okay, doing an ABG is a skillful process that's all about safety and accuracy. It's so important to perform what's called an Allen's test first to make sure the hand has good blood flow. Afterwards, you have to apply firm pressure for a good 5 to 10 minutes to prevent any bleeding. And then, that sample has to get put on ice and sent to the lab immediately to make sure the results are accurate.
Now, while it's a super common procedure, it's not totally without risks. Patients might feel some pain or get a bruise at the site. More serious stuff like an arterial spasm or an infection is pretty rare, but that's exactly why using the proper technique every single time is so crucial.
And this brings us right back to where we started and why the ABG is just so vital. In critical care settings, we're talking the ICU, the emergency room, any patient on a ventilator. This test is way more than just a test. It's a lifeline. It gives the healthcare team the real-time data they need to make adjustments and literally save lives.
So, the next time you see a set of ABG results, I hope you don't just see a bunch of random numbers. I want you to see a story about a delicate balance, a constant struggle for equilibrium, and a body that's trying to communicate exactly what it needs. The real question is, are you listening? What is your patient's body trying to tell